Diane, you mentioned feeling lost. How did you find your light and the path forward into transferring those skills and into doing something, building your dream?
Well, honestly, a piece of it was a friend who was not in medicine at all, and she had been working in IT in the prison system, so a pretty high stress job. And she decided that she wanted to become a yoga teacher and a writer. And it was a 180-degree change in her career. And I talked with her a lot about what was her mindset? How did she make that transition? How did she sit with herself as her identity changed from this one position that was stressful, and also it was an appointed position, so there was some clout associated with it. How did she do that and go to something that was less flashy? And that I found incredibly helpful to speak with her. And I think I was also very lucky. I in the last year I was practicing, I went back for the master's in public health, and I knew that I was very interested in understanding the larger system factors in our healthcare system, and was really fascinated by learning about ethics and business and some of the other kind of community-based health, and how that what the drivers are of that. And so once I did that, I was really open to looking for anything, and I happened to see an ad in the back of a medical journal for a position as medical director at a communications company here in Boston, where I lived at the time. Now, I have never before or since seen ads like that in this particular medical journal. They're usually clinical advertising, or jobs that are clinical. And it ended up being a great stepping stone job. I worked there, I had lots of on the job training. And so when I decided to become a freelance writer, I could do it. And so I had taken kind of skills that I had from undergraduate, and I'd applied them in healthcare, in terms of writing, and was able to make that transition. And again, I could not have done what I did for those 20 years if I hadn't been a physician and didn't have that clinical training. So it felt like nothing is wasted. But it was really important that I continue to follow my passion, and not kind of like Brian had used the word apathetic. I think if I had become apathetic and stayed in any of these, it really would have been a not so pretty picture. But the fact that I kept saying, oh, this isn't quite right. I don't think this is working for me. I'm going to look for something, and continue to try to see where might I find that. How could I use what I know or the skills I have now and apply those in a different setting that might be healthier for me.
Yeah,
I think
that's
really
good that you saw that, because
yeah.
in my instance, I got to the point of apathy, and I knew I had to get out of engineering before I started making mistakes in my calculations and stuff. So, and kind of in the same way that you are, I'm still trying to figure out how to make the skills I learned from engineering cross over into other areas. So I think that's a blessing you found your direction quickly.
Yeah. And I like the fact that you're pointing out that, in one sense, your passion didn't change, because your passion was still helping people. It was still, patient safety, and you just decided to shift a little. So it wasn't like you were abandoning medicine at all. And I think that's good for people to hear. So, I thought I wanted to go into medicine, and I actually worked with a bunch of pathologists who, they were an interesting group, but they all told me, if there is anything else that you want to do or could do in medicine, like maybe you should go that route. And there were a lot of changes happening at that time. That was also mid-90s. But I never thought about that. And I think that so many of us don't think about all of the different avenues. You think, nurse, doctor, you don't realize, oh, well, there's actually 1,000 other ways that you can help patients and that you can help the medical field. So I think that's really encouraging that you you saw that there were other opportunities and that you went out and started investigating and looking for the right fit within that medical field.
Well, thank you, but that makes it sound like I was so much more intentional than I was. It was more, honestly, when I left clinical practice, it felt a little bit like I'd escaped, like
Hmm.
something bad was going to happen and I had escaped with my life, was kind of how it felt. So it was a bit of a relief. And at the same time, it was also incredibly sad because I had spent so many years and all my 20s basically, to get to that point, and it didn't work. It didn't work for me. And so it was this combination. So yes, I was able to make those transitions. And in hindsight, it sounds like, oh, that, I knew what I was doing. But no, I actually didn't.
Yeah, that's a good point too, Diane, because I think the three of us, Masha, Michelle, myself, Brian, we've all gone through that a little bit as well. And you're right, it's not this super smooth transition where the path forward looks super easy and you know exactly what to do. It takes some time to figure that out. And when you're looking back, it always looks easier than it is in the moment when you're trying to figure that out.
Yeah, absolutely.
And Diane, when you realize that you're not the only one who is struggling in this culture of the medical world and concerns that you've had, how did you come to learn about the professional physician burnout in the healthcare industry? Did one day things just fall into place? Was it more of a discovery through conversation? Tell me a little bit more about when you made that transition about looking into the healthcare system, and majority of physicians are struggling with burnout. Are there any statistics or any information that you can share about what is there that most people don't have the knowledge of?
Right. So in terms of when I got involved in this, it was probably the end of 2011, so a good bit of time ago. And I was encouraged or slash pushed by a very wise friend to tell my story. She said, you should really share your story. It might help someone. And my initial response was, there is no way I'm going to do that. Like this is a weakness. Why would I share this? And over time, I came to see that she was probably right. And I did share my story, and immediately physicians began contacting me to say, I didn't know anybody else felt this way. Here's my burnout story. And I realized how big this was. And it was really hidden at that point. I mean, there was not a lot of writing out there. And so after that, I was asked to be on a task force. I did some speaking across the country. I was lucky enough to write a book with another physician where we spent 15 months interviewing folks about burnout. And what came up over and over and over again was that burnout is a reflection of stress in the workplace. It's really not about the individual being weak or overly susceptible or sensitive or anything like that. It really is stress in the workplace, and that can take on various forms in terms of stress due to a values conflict with the organizational leaders, or it could be unfairness with how people are treated, like people within different specialties in medicine, either making more money or less money, or having special privileges within the hospital or not. So that, like, unfairness, and workload. And if you have a tremendous workload and don't have the resources or the support staff to do it, that is a recipe for burnout. So understanding that it's really the system, and that was my focus for a long time. And in that period of time, writing the book, and that came out in 2016, and then we revised it in 2020. Back at that point, I think the burnout numbers were more like 40%, and now they're somewhere around 55 to 60%. So they're incredibly high, and COVID was part of that. But this epidemic was occurring long before COVID, and it was recognized actually as an epidemic before COVID. So the numbers are really disturbing. Another piece of data that's also disturbing is the number of physicians who are leaving practice because of burnout and also retirement, right? We have baby boomers who are now of retirement age. But it begins to be an access problem for patients. So there's a lot there. There's all sorts of data. The numbers continue to, in the past couple of years, to rise in terms of physician burnout. And I decided to focus on women in medicine in particular because their burnout numbers are higher, and specifically those kind of mid-career, early career women tend to have the highest burnout numbers. And that's a area of focus that I really care about. And I think there's so much that can be done for that group, for all. But especially there's some particular challenges that women in medicine face that really could be addressed better than they are.
Wow, those are alarming numbers. In some industry sectors, we've seen burnout rates as high as 80%. And part of why we're spreading awareness is unrecognized burnout kills. It does kill. And if we're lucky to recover from that, many of us become the messengers of, hey, not every single symptom that you have is just one and off. And you go see 12 different specialists for a different symptom. In my case, they were all connected at the core. Common denominator was prolonged stress-induced burnout. And part of our passion is to have our listeners have aha moment. Well, maybe my weight gain and GI problems and depression and anxiety and a laundry list of other things have to do with an ongoing stress I've been having, whether it's professional burnout with performance or many things just layering onto itself, leading to collapse. Are there any other statistics that you wanted to share with us about the medical field specifically?
Well, one of the statistics that I think is concerning in terms of women in medicine is that there's some studies that have shown that within 6 years of finishing training, 40% of women physicians have either cut back from part-time or cut back from full-time, so they're part-time, or have left entirely. So, and the same study, the male physicians had not cut back. So there's something happening in those early years that's incredibly stressful for women in particular. And another piece of that is that women physicians have an infertility rate that is twice that of the general population. And so part of that is starting families later, but that's not all of it. Some piece of it is stress and circadian rhythm being disturbed. But right when they are beginning their practice, they've finished training and they're just launching their careers, is also when many of them are starting to have families and struggling with infertility and infertility treatments. And so that's a whole other added stress for them. And the other piece that unfortunately I would add is that the suicide rates. So there's not tremendous great data on this, but it looks like physicians have a suicide rate that is about twice that of the general population. And so it's estimated that we lose about 400 physicians every year to suicide. And that's the size of one or two or more medical school classes that are just gone. And it is incredibly devastating to a community, to patients, to the organization when a physician dies by suicide. And so there is a connection between burnout and suicide ideation. And so it's really something that we need to be so aware of. And if there is someone who you're concerned about, to talk with them, to say, hey, can we get a cup of coffee? How are you doing? To really reach out. And there are suicide hotlines numbers that are available as well that folks should have access to.
And we'll definitely publish them in the description. So if anyone is struggling with some of those thoughts or knows somebody who is, know that there is help and it's okay to ask for help.
Yes.
Yeah, and it seems like that it's hard, especially in the medical profession. I think it's hard to ask for help because everyone is normally coming to you as the physician to help them. So, Masha and I have worked with physicians. I've actually worked with them my entire 25 years. And I've seen some that when I look at them, my thought is, oh, like you don't look healthy. But I don't know how, I'm not a physician. I don't know how to encourage them. It's really hard to look at them and say, I think you need help. And you can see it on their face. But yet it's so hard. It seems to be so hard for physicians to ask for help.
And
Absolutely.
one thing that can inspire that, and burnout is still not a common diagnosis in healthcare, although I believe now that there are diagnosis codes. I have not seen any protocols to treating burnout. And a concern that comes to me is that if our physicians are burned out, if up to 60% of them are burned out, and we have patients who are presenting with similar burnout symptoms, our physicians are ill-equipped to diagnose those patients and give them the right help. So if we can spread that awareness of there is a thing, how do we treat it if people themselves who are going through that are ill-equipped to make those connections?
Right. So it's a little tricky because burnout itself, professional burnout, is not a disease state per se. And so it can be a little bit more tricky to come up with like a list of criteria. Like if you have this, this, and this, then you've got burnout. What I will say is that with the clients I've worked with, there's this continuum. And I should back up to say there are assessments that will look at, there's the mini Z burnout assessment. There's others that have been done that really can give you a sense of if a population has like what the rates are, but they're not meant to diagnose individual people. So like the Maslach burnout inventory is one that's used very often. And that was really developed as a tool, a research tool to look at the prevalence within a population rather than saying this person has burnout and here's the thresholds. That said, what I have found is that it almost, whether you call it burnout or whatever, you can tell when someone is not thriving and they have some of the symptoms, Masha, that you described. And whether you call that distress, burnout, stress, whatever, something needs to be done. And there's this continuum where someone might be aware that occasionally they feel, some of the components of burnout, all the way through there's true cognitive and physical and emotional impairment. And often they need time. So they need a medical leave. They need 6 months off to literally physically recover. And so there is this spectrum, and it's incredibly important to get that help. What that looks like can differ for different people depending on the severity and where it's showing up.